Good afternoon, everyone. I'm Dr. Yanin Nokdes from Department of Dermatology, Faculty of Medicine, Siriraj Hospital, Mahidol University, Thailand. Today, I'll be talking about a randomized double-blind split-phase study comparing the incidence of post-inflammatory hyperpigmentation following a 532 nanometer picosecond laser, comparing between broad-spectrum and broad-spectrum sunscreen with iron oxide. First of all, I'm sorry, I have to tackle this thing. Okay, thank you. So first of all, I have no conflict of interest to declare. And as we all know, post-inflammatory hyperpigmentation is a major concern for post-laser therapy, especially in dark-skinned patients. It is multifactorial, but the main environmental influences include UVA, UVB, and visible light. Current sunscreens, broad-spectrum sunscreens, protect us from UVA and UVB. However, UVA and UVB are only 5% of the solar radiation that emits through the Earth. The other 45% is visible light. Nowadays, we already know that visible light also affects PIH as well. Current tinted sunscreen, including iron oxide, provides protection against the whole wavelength of visible light. Therefore, our study is aimed to compare the incidence and severity of post-laser hyperpigmentation after applying broad-spectrum sunscreen with and without iron oxide. So in our study, we included patients with evenly distributed bilateral solar antigens, excluding those with other pigmented skin conditions and history of sunscreen allergy. In our session, we did a 532 nanometer picosecond laser for the patient's whole face on the solar lentiginous areas with a spot size of 4.5 millimeter and a fluence of 0.7 to 0.8 with an endpoint of sub-minimal immediate whitening. And patients were randomized to apply broad-spectrum sunscreen on one side, while the other was applied with broad-spectrum sunscreen with iron oxide. We followed up the patient until 3 months after laser. In our study, we included 30 patients aged between 24 to 55 years old with a mean age of 32.9. Most of our patients were female, with skin types mostly 4. You can see from this chart that the severity and extension of PIH is not so much different in 2 weeks after the laser, but you can actually start seeing the PIH already. This also continues to not really see any significant difference until 4 weeks. However, at 8 weeks after laser, we can see that there are significant difference between the size treated with broad-spectrum sunscreen with iron oxide and without iron oxide. And the difference is in terms of both severity and extension. It has continued to be significantly different until 12 weeks as well. When you see the melanin index according to the measurement, you can see that there are significant difference in decreasing the melanin index on the side that was treated with broad-spectrum sunscreen with iron oxide. However, the side treated with broad-spectrum sunscreen without iron oxide, there was no decrease in melanin index. This may be due that there was accordingly quite some PIH after the treatment. However, when we compared on both sides, there was no significant difference as well. So now let's look at some of our pictures of the patients. As you can see, the patient on the baseline has only few solar antigens, but as we follow up the patient up until 12 weeks after treatment, you can see the PIH occurring on the malar area of both sides. But however, if we look closely, the side that was treated with broad-spectrum sunscreen with iron oxide had less PIH when compared to the side treated without iron oxide. So here's a closer-up look for you to see it more. You could see the extensive PIH on the malar area on the left side of the patient, while compared to the right side that was treated with iron oxide. This next one is another patient of ours who had extensive PIH after doing laser. But though the extensive PIH was present on both sides, the side that was treated with broad-spectrum sunscreen with iron oxide had less extensive and severity of PIH when compared to the side without iron oxide. Here's also a closer up look as well. So in conclusion, broad spectrum sunscreen with iron oxide exhibits significantly superior efficacy in reducing the severity and extent of PIH following laser therapy when compared to the use of broad spectrum sunscreen alone. So this is also another thing you could improve for the better outcome of your patients in laser therapy. You don't need a new technology or you need a significant way of learning a new technique or anything. It's just as simple as applying the right sunscreen for your patients. Thank you so much.